Hi, I'm Allison Bold, the Director of Radiology at Nantucket Cottage Hospital. Today we're going to dive into the 4 MRI safety zones, why they exist, what they mean, and how they keep us safe. This quick presentation is especially for healthcare workers who walk by these zone signs every day and wonder, what does that really mean? MRI scanners use magnets 30 to 60,000 times stronger than the Earth's magnetic field. Mind-blowing. In the MRI scanner, the magnet never turns off. So if anything magnetic is mistakenly brought too close to the MRI machine, it can be violently pulled into the magnet, bringing whatever is attached to it with it. Things like oxygen tanks, IV poles, wheelchairs can be violently pulled into the scanner if it comes too close. In fact, there was a tragic incident in 2001 in which an oxygen tank became a projectile and tragically killed 6-year-old Michael Colombini. This incident compelled the American College of Radiologists to take a deeper look into MRI safety, and this is when the MRI Safety Zones were born. MRI Safety Week is celebrated every July in memory of Michael Colombini. Imagine you're responding to a stat MRI. In a rush, somebody brings in a metal oxygen tank. The consequences can be catastrophic. The next video will demonstrate what can happen if an oxygen tank is brought too close to an MRI scanner. These 4 MRI safety zone signs are what you might see as you walk around your hospital. Now let's get down to what they really mean. MRI Zone 1 is open to the general public. There is no MRI-related danger here. Think of lobbies and hallways. This is Joanne. Joanne is leaving registration and heading to have a seat in the outpatient public waiting room. This is Zone 1. While this is the least controlled zone, it's where signage and MRI awareness should begin, setting expectations for restricted access ahead. Zone 2 is the screening area, or what I like to call the gatekeeper zone. This is the transition zone. Patients are now controlled by MRI staff here. This is where screening begins. Joanne is now seated in our MRI waiting room where patients get interviewed, change clothes, and get screened for implants or devices. This zone is crucial as it acts as a filter for unsafe individuals or devices. Mistakes here can result in serious incidents downstream in zones 3 or 4. Joanne is in zone 2. Some of the questions you might be asked while being screened for MRI are, do you have any implanted devices like pacemakers, cochlear implants, insulin pumps? Have you had any surgeries involving metal where you might have clips, screws, or rods? Do you have any body modifications like tattoos, piercings, magnetic nail polish, false eyelashes, permanent makeup? Zone 3 is restricted or controlled access. This zone borders the scanner room and must be tightly secured. Zone 3 is where things get serious. Only trained, badged staff are allowed in Zone 3. This area has strict badge access. Only a handful of staff in my hospital have access to this area. Here I am badging into Zone 3. I have been screened by our MRI staff, and my screening form stays on file. Everything in this area should be MRI safe. Only MRI safe oxygen tanks as seen here. Fire extinguishers, footstools, chairs, wheelchairs, for example, can be used in this area. Here's Joanne in an MRI safe wheelchair. Joanne is in Zone 3. Zone 4 is the MRI magnet room, the scanning room itself. The magnet is always on, 24/7. In this video, you can see my ID badge being brought toward the MRI unit itself. Again, anyone entering Zone 4 must be fully screened and cleared. This is where thermal injuries, device malfunctions, and projectile incidents are at greatest risk. Zone 4 is never a place to cut corners. Here's Joanne having an abdomen MRI. Joanne is in zone 4. Let's test ourselves on what we've learned today. Guess the answer. Which of the following best describes zone 1? Did you get the answer right? Public areas like hallways and waiting rooms is the correct answer. Next question, what activity typically occurs in zone 2? Correct, patient screening and interview. Question 3, what must happen before a patient is allowed into zone 3? I think you knew the answer to this one. Full safety screening and tech clearance. And the final question, what is located in zone 4? This was an easy one, of course, the MRI scanner itself. MRI safety is about access control. Zone 1s through 4 help us manage who goes where and what gets brought in. A great mnemonic to help you remember what each zone stands for is people should check magnets. Public screening controlled magnet. That's MRI safety in 5 minutes. I hope you enjoyed it. And remember, when moving around the hospital, keep the zones in mind and always know where you are. Does anyone have any questions or comments?